So to get started, I'm thrilled to introduce Priya Motz to all of you. Hopefully, I'm sure some of you know her already. She is the Quality and Health Equity Transformation Branch Chief in Quality and Population Health Management for the Department for Healthcare Services. She's also a CIN primary lead representing DHCS in the network for this current 2-year cycle. We at the partner meeting, which many of you here were at, we started this conversation about, CIN is not necessarily built to, it's not about creating technical assistance for Cal-AIM or making sure that these certain goals are achieved, but it's part of trying to support all of you with your highest priority work, your highest priority improvement work. And so, of course, it is tied to these big things like the bold goals that DHCS has laid out around equity, and some of the other big goals related to Cal-AIM. So we wanted to help this group continue to deepen understanding about, what are these bold goals? How does that fit into my work? What are others in CIN doing? And how can we all work together to make progress? So today, our learning objectives are that by the end of this session, you'll be able to describe DHCS's comprehensive quality strategy and 50 by 50 Bold Goals initiative, and also identify how CIN partners' organizational priorities contribute to and advance these goals. We'll do about 30 minutes content and then 30 minutes of discussion. So get ready and please don't be shy. And we'll go ahead and get started. I'll turn it over to you, Priya. Thank you so much for being here.
Thank you. Thanks for having me and glad to share sort of the objectives and the work that we're doing at the Department of Healthcare Services around these goals. And I will share my screen and please let me know if it shows up. Hopefully everyone can see it and
That's great.
Okay, great. Thanks. So as Rebecca mentioned, Priya Motz with the Department of Healthcare Services, and really a lot of my work, if I haven't worked with you directly, a lot of what I do is really quality improvement and equity improvement efforts among our delivery systems for Medi-Cal members. And so I'll kind of go a little bit over today of just an overall really high level overview of the comprehensive quality strategy and from which the bold goals were born. And then kind of go through a little breakdown of those bold goals and how we're trying to address them or look and perceive them at the state level, and sort of just not only the internal change at our end, but how we can all work together and collaborate in working towards achieving these goals. And then hopefully have time for some just quick discussion questions and sort of collaborative efforts we can do together and just work together. And so with that, I'll just kind of going into sort of the vision of the comprehensive quality strategy. And this was taken into account sort of history of data that DHCS had accumulated, not only throughout the public health emergency, the initial phases of it, but also prior to the PHE, and sort of looking at what our data is showing. A vision was born, and many of you might know our Chief Quality Officer, Dr. Paul Bavaria, who really sort of envisioned what we should envision, guide us in our work at DHCS and how we can approach our strategy for improvement. And so a lot of it, really what we were noticing is that we really need to get back and talk to our members, really understand, empower them for their care and really understand how their experiences are. And then also bridging that, treating more like a whole person care. It's not only the member we're treating, but we're also looking at the families, the communities, the environment in which this member lives in as well. And then also providing sort of, it's easy for us to kind of jump to those sort of more chronic conditions already when the member is diagnosed with a chronic condition or even newly diagnosed. But how do we prevent that from happening? How do we address it and kind of mitigate comorbidities as we go forward? And then, really the overall theme is just, not only focusing on medical efforts, but also behavioral health efforts. Healthy mind, healthy body is really what we're trying to, understand, kind of really envelop the member and really looking at it from a whole person approach. And what our targets have been, as we kind of looked at our vision, is really trying to get down and get to the health disparities, really through anti-racism approaches and community-based partnerships. And also really looking at our data and ways to improve it and address the whole person, looking at our data gaps with even across our delivery systems with dental and kind of behavioral health plans, as well as with our managed care partners. And so, and another big one is we're trying to be really as open as much as possible, and really not only at the state level, internally, but also with all of our stakeholders and work groups, so that we all can understand why we're going down this road and why we're approaching quality and equity in this manner. And so one of the big things is we kind of took an aerial view of quality at that time in the comprehensive quality strategy report. If you haven't seen it, I can provide a link. It's a hefty report, but we update it annually, but really in 2022 is when we sort of really outlined the framework for it. And one of the big things was sort of brought out, it was really trying to bridge across and align quality throughout the organization. Not only in one silo, but really trying to knock those walls down and really sort of communicate internally within Department of Healthcare Services, and really reaching out and ensuring that our quality metrics sort of align with some of the other delivery systems as well, so that we're all working towards the same goal. And so you can see here some of the different data sources that we have, as well as entities within DHCS that we try to really align through, our Medi-Cal managed care plans, as well as all the way down to Medi-Cal RX. And also aligning our value-based payment programs with our public hospital organizations, with the QIP, Quality Incentive Program, as well as with the FQHCs as well. And with that, it kind of evolved our continuous quality improvement cycle of, knowing that it's not really just a linear pathway, and it's really sort of an evolution of how we kind of take everything together and churn it into meaningful, sustainable quality. So I won't go into too much detail here, but really sort of how we did it was looking at payment, looking at payment reform and sort of addressing sort of that financial aspect to it, really putting the assessment and performance improvement into it, as well as sort of having those dashboards for visibility on how those efforts are going. And then a last part of sort of that cycle is a chunk of it is sort of our external quality review organization, who helps us with sort of our, kind of bridging any potential recommendations that they have as well, that we try to incorporate within our improvement efforts. And from what they see as a third-party entity, when they take in our data as well, and help us with our reporting disparity work as well, just really trying to grasp with an outside party with the recommendations as well. And with that, after we took all the data, really looked at it, dissected it, digested it, and really internalized it, really the big thing that the three big clinical focus areas that we really saw sort of deficits within our efforts was really children preventive services, behavioral health integration, and maternity outcomes and birth equity. Those were really sort of the big buckets of focus areas that we really saw the need to kind of dig a little bit deeper and sort of work in sort of bridging those gaps that we had seen. And not only with that, it really on hand in hand, quality and equity go together. And so as we're bridging out our quality improvement framework, we're also trying to address some of our health equity framework as well. And so indeed, and we are in the process of coming up with the equity roadmap that should be, down the road. And our Chief Equity Officer, Dr. Pamela Riley, is actively working on that and really trying to make it meaningful and representative of sort of the work that we need to get through. But this is really sort of, setting a foundation and really trying to create standards that are standardized across our organization, and really having that mindset that we're all working towards quality and equity improvement efforts, and not only within DHCS, but also with our partners, our collaborative partners that we work with. And so, trying to make sure that we are aligning our measures, also being in, not the pleasant side, but not only with the carrots, but also the sticks as well. So with our incentive programs, we do have also penalties as well for maybe falling a little below our benchmarks that we have established. And then with that, we're hoping that this will go, and with a strong foundation, we can drive toward change and really sort of transformation of the work that we do statewide as well. And so that's sort of really the idea behind the work that we're trying to evolve and sort of create that strong foundation for. And so the big thing these are our very, I think it's been called multiple times in the past, and even more recently, very ambitious, the 50 by 25 bold goals. And so really what we're trying to do is, with those clinical focus areas in mind, children's preventative services, behavioral health integration, maternity outcomes, and health equity, the bold goals were sort of born from those. And so really what we're focusing on is not, like as mentioned earlier, quality and equity, just that really goes hand in hand in the work that we do as we kind of move forward. And so really trying to look at children's preventative services, not only on a quality lens and trying to make those improvement efforts, also trying to close disparity gaps that we see in our data. And with that also maternity care disparities as well that we see at the statewide level. We really do see our Black African American population and Native American Alaska Native population really do have disparities that we would like to work on and collectively and really trying to improve those health outcomes, as well as improving maternal and adolescent depression screen. I think many of us, we knew prior to public health emergency how important having a healthy mind and just kind of making sure that we're screening our members and getting them the care that they need. But really as the public health emergency unfolded, disparities widened with that. And so not only are we seeing disparities with it, but we're also seeing higher rates of depression or diagnoses of these conditions. And so we really want to make sure that we're, helping our members by screening them, getting them the care that they need, and plugging them into all the resources that we have. So we're really trying to focus on sort of behavioral health aspects as well. And then, and that goes in hand with mental health and substance use disorders as well. As we know, it's high, and getting into resources and plugging in members to resources is definitely a high priority as we try to improve the overall health. And then lastly, which I think maybe a little bit ambitious, is trying to, with our Medi-Cal managed care accountability set measures that we sort of assess and track annually with our county, our managed care partners, as well as with other delivery systems as well. We're starting to evolve the quality measures that we track across all our delivery systems. And so with that, trying to achieve or exceed our benchmark, which is the national 50th median percentile, which is the median for our rates for that. And that's for all children's preventative services. So infant well visits, well child and adolescent well visits, as well as our immunizations, not only as a baby, those immunizations that occur as a baby, but also during adolescence as well. And then lead screening, topical fluoride treatments, and developmental screening. So there's a good chunk of children's preventative services that we're looking to really evolve and promote healthy children. And so that's definitely something we're trying to achieve. And how the state is working on doing that, as mentioned, this is that Medi-Cal managed care accountability set. And these are measures that we track annually. We have our plan partners report on, and we also have our, for the relevant measures on here, our counterpart delivery systems are also tracking as well. And so I'll kind of highlight those measures as we go through. But in children's and adolescent preventative health, as mentioned earlier, we have well visits, immunizations. We also are looking at lead screening, topical fluoride, developmental screening, and really trying to make sure that we're capturing and ensuring that when that member goes in for their well infant visit or the well child visit, that they're also getting those other services that they need to help for prevention. And and so those are, I know that children's preventative services are our largest domain, and that's definitely intentional, and definitely something that we see at the state level is that children's services are definitely lagging behind, and we're trying to work to promote those healthy children. Also, additionally, the other health domains that we have that help fit into the bold goals is reproductive health. And so chlamydia screening, prenatal, postpartum care visits, as well that we track. And we're really trying to, and you'll see little asterisks for some of these measures, and those are signifying those measures that we actually stratify by race and ethnicity as well, and sort of validate with our external quality review organization, validate those rates. So we're also trying to look at the racial ethnic stratifications to see what disparities are there, and then how we can work to improve those. And it's just that fits in with those, the part of the goals. The red measures are, measures we're hoping to add in 2024. And so those are, helping to build on the, maternal depression screenings, the postpartum prenatal depression screening, and prenatal immunizations as well. Just, it's so important to get those immunizations when we can get them during the pregnancy. The other three domains: behavioral health, chronic disease, and cancer prevention domains. And so for behavioral health, we are also having our counterparts, kind of behavioral health plans, also are tracking certain behavioral health measures as well. And all those measures are involved after emergency department visits for both mental health illness as well as substance abuse. And so our kind of behavioral health plans are also tracking those measures and trying to have efforts to improve those. And just because those two measures really go hand in hand, and sort of the work, and then also just transitions of care between the two delivery systems is really important. We're hoping to add 3 other measures in 2024, and that's depression remission response status in adults, as well as screening and follow-up. And pharmacotherapy of opioid use disorder is a measure that our county behavioral health plans are actually tracking for measurement for 2022 and this current year cycle. And so that's something that they're tracking already. And so we're hoping to get that on our radar as well, just to make sure we're looking at it from both lenses, the managed care plans as well. And then chronic diseases as well, chronic diabetes for port control and controlling high blood pressure, as well as asthma medication ratio. Asthma medication ratio is a measure that we previously had prior to Medi-Cal RX on our accountability set. That recently just got added back in again. It was report only, but with as we know from the past, there was some disparities identified in that measure. So trying to make sure that we're looking at it and ensuring that those disparities, we're kind of closing the gaps on those as well. And then cancer prevention, breast cancer screening, cervical cancer screening, and in 2020 we're hoping to add in colorectal cancer screening. It's definitely a measure that we can kind of get in more in our older population in the Medicaid systems that may have fallen off through non-Medicaid. And so why is this important, and why am I telling you all of you about these bold goals, and you're probably thinking, how can I impact it? But really what we're trying to do, it's not, it's really more of a collaborative area. And as I mentioned earlier, how we're trying to approach it at the state level is really trying to spread the efforts across our department. So putting it within our quality incentive program with our public hospital systems. Those measures, they are very similar, and if you're affiliated with the public health hospitals, I'm sure those measures look a little bit familiar. With the MCAS measures look a little bit familiar, as well as what is being reported through that program. And also, as mentioned, we're trying to even have our other delivery systems also report on similar measures. Our dental health plans are reporting those dental measures, as well as our kind of behavioral plans are also reporting on the behavioral health measures as well. And then really trying to also leverage the new benefits that we have. And when we were thinking about the bold goals, what would help with that, and trying to provide those services, community health workers, doulas, dyadic services, really trying to focus in on sort of those 3 clinical focus areas. Enhanced care management and community supports also sort of support those ways that those measures can sort of be assessed and sort of also focused in on. So enhanced care management, by providing these services, potentially you're also impacting those quality measures as well. Just like plugging in and having that outreach and being able to help with navigation and health systems as well, and which as many of you know, ECM is also it's expand in the summer to our children population as well. And then we do a number of just quality efforts internally with our plan partners as well, and really trying to break it out by regional quality improvement efforts to really sort of get to those, geographically variations that potentially we can't grasp if we aggregate everything by the state level. So really trying to break up the state into regions and really assessing in those regions how can we best partner and help our all of our delivery systems and make these improvements. And so, and then I'll kind of gloss over these next few slides. These are really just sort of potential like ways to how where we see the gaps and potentially where there's areas of where we can kind of bridge these sort of benefits, also plug quality improvement efforts. And so this is just sort of an example of, what I'm trying to, during that birthing phase, just from even the prenatal period all the way to when the baby is born, there's so many different areas where potentially are the benefits that Medi-Cal has, as well as all of our partners together, where we can work not only with community, the hospital systems, our providers, our plans, our delivery system plans, as well as with the state of where we can potentially impact and make that difference throughout that whole process. And again, just to like highlight that, and then also like when you're kind of thinking through it, there's certain things where almost each domain can be triggered, when you kind of break it up with, prenatally, there's a lot of measures that can occur and a lot of screens that can happen in that phase. And it just as you go through the whole cycle to when the baby is born, just it definitely can cover, chronic diseases. If you're checking for if they have high blood pressure, and you're kind of plugging them into controlling that, as well as any depression screens that can occur, infant well visits, immunizations can get done, after the baby is born, and also the postpartum follow-up visits. And so there's definitely a lot of things can trigger just through that whole cycle in a member's phase. And so it's definitely different ways that we can have that direct impact together, I should say. And so it just kind of breaking it out of like different programs that are available that are very helpful, and that we've heard such great stories from many of our plan partners and also our community partners as well, just like how these resources, they're out there, they're ready to be used, and how we can work together. And just, these are some examples, but just also there's just a large number of resources, especially in very geographic areas for sure. And then another big one, just a plug in for the dyadic services is a new benefit that can really support you. Dyadic services essentially where we're trying to we take care of that infant, that baby, but also are taking care of the mom at the same time. And the idea is to, when you have one in the office, being able to treat the other one simultaneously as well. So really trying to provide that infant visits, immunizations, and screenings, but also support the mother's mental well-being. And so dyadic services, it's relatively new, just of this year, and so there's definitely different ways that potentially can build off of that, and how our community health workers can help and kind of promote that effort as well. And really, it's just trying to drive prevention, early detection, and creating sort of that understanding, and also a safe environment for everybody, and for those members to have it done all in one day rather than having to come back over and over again, where they may not feel can't take time off of work. It's just a struggle to make it back into the office for that stuff. And so I'll bring it back into the full circle, sort of that infrastructure change of how, how does this all impact it, and how we, when we think about our quality foundation and our equity and framework improvement, how does that all work together? And you can see that this diagram it's really just pulling each of these sort of aspects that we went through, really addressing sort of those core foundational model changes that we were looking for. Really leveraging the community environment, treating the whole person. Trying not to look at just one aspect, just the infant, or just the mom, just the dad, or just the brother or sister or any siblings, rather than looking at just that one, treating that whole person, that whole family, and really having more of that community effort. And then spread of best practices. And that's a big one, more in the sense of what works in one area is not necessarily going to work in another area. So really trying to, with our regional mindset of trying to say, okay, these are in this region, can we work together and really sort of spread? If something's working in a similar geographic region here, can we spread it to another one that's similarly? And so really trying to bridge sort of not only our own silos within DHCS, but also within our community partners, our delivery system partners as well. And then really just trying to promote collaboration. I know I said that a lot today, but really, really trying to say, we can't get this done if we just work independently. And it's really a team effort among all of us at the state plan level, the delivery system level, as well as in the communities and with our providers, as well as members. I think that's the one thing that's the most important thing is really when we work together, we're really enhancing the care that we provide to our members and really helping with those efforts, getting them plugged into all the services that they need. And it's definitely, I think something where we all are doing the work that we do is really trying to enhance our population's health. And with that, I will stop talking and hoping we can all sort of come together and talk and see, have an open conversation of how maybe now knowing what these bold goals are and sort of what they represent, how they came about, how is your organization aligning these efforts with sort of our efforts that we have in the clinical focus areas and health equity goals? And I'm hoping you'll come up and open up and talk a little bit more about those efforts.
Yeah, thank you so much, Priya. That was an excellent overview and some great insight into sort of where this all came from, and also all the different parts of both programs, parts of the agency, and how all of us on this call plug into this. So excited to move to conversation.